My name is Lyle Murphy, the founder of the Alternative to Med Center. And today we're going to be talking about a drug called fluoxetine. First question, what is fluoxetine? Well, fluoxetine is an SSRI, which means that it is a selective serotonin reuptake inhibitor. Basically what that means is this drug poisons an enzyme called the serotoninase enzyme that is normally meant to break down serotonin, forcing it to stay locked into the synaptic cleft and exert an inhibitory response on the receptors that are located on the next nerve. Generally, what happens after that is the serotonin being forced out there goes through a process of being broken down into metabolites, kind of like if metal were to rust, and there's no serotonin left to reuptake. So medication like fluoxetine doesn't actually make serotonin, it spends it. Next question, what is fluoxetine used for? It's actually a decent sleep aid and helps people with OCD. However, its prescribing categories are for depression, obsessive compulsive disorder, panic disorder, for bulimia, and for premenstrual dysphoric disorder. Those are the things that it's prescribed for. Next question, is 40 milligrams of fluoxetine considered a high dose? The average target dose for fluoxetine, I would say, is about 20 milligrams. That's at least the starting dose. And as prescribers do, they typically will bump you up to 40, maybe even 60. As we look at things, especially when it comes to medication, we want to go with the most conservative as possible. We of course want people to try to do things without the medications where and if possible, but rather than scaling up the medication, like if 20 milligrams is doing the job for you, then maybe consider leaving it there and working on other things in your life to try to get more balance so that you don't need that medication long term. Next question, does fluoxetine cause weight gain? This medication is not really one of the medications that typically packs on pounds. It would be considered probably a weight neutral antidepressant. However, long term, it is associated with an increase of weight, a modest to moderate increase. Next question, is fluoxetine considered a controlled substance? So a controlled substance by definition is a medication that people are known to abuse, and so therefore it's controlled. This is not one of those medications that people are likely to abuse. However, it is controlled in the sense that you need a prescription, at least in the United States, to obtain this medication. Next question, can you overdose on fluoxetine? If you overdose on fluoxetine, even if you took the whole bottle, it's very unlikely that it would result in a fatality. It could result in a hospital visit, and hopefully it does if you've taken the whole bottle. And the things that have been reported have been coma, difficulty breathing, and that's about as bad as it gets. Most people don't die from an overdose on Prozac, and it does happen a good bit because people who are depressed sometimes have the impulsivity to take a whole bottle of meds and have done so with Prozac. So the it's minimally toxic in doses up to 1,500 milligrams, which is, if they were 20 milligrams each, that would be about 70 pills, 75 to be exact. So it's a little hard to really do a lot of damage overdosing on this medication. Next question, is Prozac and fluoxetine the same drug? In most ways, yes. It is fundamentally the same chemical. Fluoxetine is a generic version, Prozac is the name brand version, and there are people who claim that the name brand version works better for them and have had challenges transitioning, or maybe they can't find the medication that they need because the pharmacy doesn't have it, so they go for the generic version and they notice some variations, but technically, yes, it is the same drug. Can you drink on fluoxetine? Most people will if they're prone to drinking. What you're dealing with is alcohol is a sedative, Prozac is technically a sedative, so you're combining two sedatives. You may find yourself more sedated than you had expected off of a lot less drinks than maybe you would normally drink if you're taking the medication, and therefore could find yourself in dangerous situations, especially if you're trying to drive home or if you're by yourself and you don't have someone that can care for you and end up in a dangerous situation unknowingly. If you're the type of person that even has to ask this question because you drink a lot and you're depressed to the point where you're needing medication, or you have OCD to the place of taking medication, you might want to consider like that alcohol. And why are you drinking it? Like, what do you actually... Alcohol actually can create its own depression. There's a bit of a complicated mechanism where it spends serotonin based on an insulin response, and the alcohol itself could be causing you to have depression. Maybe instead of dumping a bunch of medications on the problem, you might want to consider stopping drinking and doing things that are more commensurate with mental health and see how that goes for you. And if you like it enough, stay with that rather than drinking or taking medications. Next question. Can you take fluoxetine while pregnant? This is a difficult question for me to answer. This probably would be better placed with your OBGYN. In the literature, there's not a lot of evidence to support that it harms the unborn fetus. Although they have seen a few things, and in any pregnancy, there's about a 3 to 5% chance of having some form of a birth defect. In certain cases, it's ramped up to be twice that amount. And those are for ventricular septal defects, right ventricular outflow tract obstruction, cardiac defects, and craniosynostosis, which I don't even know what that is necessarily, but those are the things that are associated, generally heart problems in the unborn fetus. But they're not very prevalent, and it's something you would want to run by your OBGYN doctor if you are concerned. And of course, if you're pregnant, the medications you're taking probably are concerning to you, and that would be a question for your doctor. What are the side effects of fluoxetine? More common would be hives, itching, some sort of a rash, inability to sit still, extreme hives, or breaking out in red or something like that. Those are things you'd want to go back to your prescriber and say, hey, this is happening to me, as those could be signs that you're having an allergic response. Less common would be chills or fever or joint stiffness. Joint stiffness and muscle pain could also be something that could have larger implications on your health as a result of adverse reaction to medication that you do want to run by your prescriber. And some of the more rare things are anxiety, fast or regular heartbeat, headache, or increased sweating. In our experience, Prozac, though it's meant to be an inhibitory medication, inhibitory in that it helps with anxiety, helps with sleep, helps with OCD, and kind of calms down those ruminating thoughts. This is a drug that's very known to have paradoxical reactions. In other words, it can disinhibit people, have them be more aggressive, have them feel agitated and restless. And if you're having that type of reaction to the medication, you may be one of those people that has paradoxical reactions to fluoxetine. And that would be the end of our questions on fluoxetine. I really appreciate you staying with me for the duration of this video. And also remember, anything that we've said on here is really not medical advice, and any changes that you make to your medication and or taking supplements should be run by your prescribing doctor. And this is just meant for information that you might share with the prescriber. Thank you very much, and have a good day or night.
Thank you for watching. Don't forget to subscribe to our channel. For information about Alternative to Med Center, give us a call at 888-984-9667.